Look at that face.
Tenielle Easter shows off photos and video of her bouncing baby boy who's home with a sniffle on this day.
Oh my gosh, he's smiling.
There's joy now, but 3 years ago, as an 18-year-old living in a northern Manitoba First Nation, Easter had a miscarriage.
And I was bleeding, so I went to the hospital, and then that's where they gave me the bad news. It was very, very hard and traumatizing for me.
Easter's story echoes those of many women living on remote First Nations and the maternal care crisis they face. Studies show the rates of stillbirths and babies who die in their first week of life is more than 2 times higher for Indigenous communities than the Canadian average. Some of the risk factors include pre-existing medical conditions, young maternal age, and reduced access to prenatal care and good nutrition. And Glenn Ross sees this as head of the Opaskwayak Health Authority.
There was really no support for young mothers that were expecting, and as a result of that, there was a lot of bad outcomes.
Most women on remote and rural First Nations are forced to travel to big cities to have their babies. Health officials are working to find solutions. They tried to hire midwives, but they couldn't recruit anyone, so they rolled the funding into 3 doula positions. Evelyn Fisher is one of them.
When you hear the word doula, they're helpers. They help you, and they help you through one of the most vulnerable times of your life.
The doulas help pregnant women with grocery shopping and cooking. They provide mentorship, education, and traditional activities, like creating a birthing bundle that includes a baby ribbon skirt and moss bag.
We find that classes are very successful, and people come back because they get that sense of they're welcome, they're safe, and they can share.
I think my favorite one is this one.
Easter says she was nervous about her second pregnancy and grateful Fisher was there to help her through it.
Evelyn really got me out of the house, got me to do walking. Yeah, and I had fun at those classes. It really made me feel good about myself.
Researchers say physician shortages and the closure of hospitals have created a maternity care crisis that could be solved by offering more services on First Nations. Karen Lawford teaches in the midwifery education program at McMaster University.
Bring it back to your community. Bring it back to, I don't know, the nursing station. Bring it back to your home. Build a birthing center.
Indigenous Services Canada says 85 First Nations are receiving funding for midwifery initiatives, but ISC acknowledges the need for more training programs tailored to the needs of the communities.
Oh my gosh, look at his hair. I tell you, he's like the sweetest baby ever.
So more pregnant women can receive culturally appropriate and safe care, and more babies can be born closer to home. Karen Pauls, CBC News, Opaskwayak Cree Nation, Manitoba.